Everyone, welcome and thank you for joining us in live. Let us wait for a few people to join in so we can start off this live. Guys, I request everyone to share the live link to people so they can join and we can start the session early. Okay, so hi everyone, welcome and thank you for joining us live. I am Hafsa Junaid from Phobase Care and I have with me psycho-oncologist from Phobase Care, Ms. Jayatri Mandal. Today we will be talking about stress, how it is different from real life and how it makes a difference in the reality. So let us see what Jayatri Mandal has to talk about the real versus real. So Jayatri ma'am, please please tell me what is stress according to you? Like for example, how do you define real life versus the real life?
Thank you, Hafsa, for having me here. It's a very important question because often we are confused between what is the real life and what is the real life, and this is same when we talk about the stress. So let me give you a few examples here. Most of the people, even we feel that stress means if something is explosive. For example, you are stuck in a traffic jam and you have a very important deadline, or you have a very kind of very significant meeting at your office, or it's a sudden cancer diagnosis. Also, for example, it can be a fear of recurrence in your cancer, or probably it's a breakup. So always we feel that within the couple, even within the young adolescent, the definition of stress really, it's a vast, it really differs. Even if you check the age group, if you're an adult person or if you're an adolescent or if you're in geriatric population, the definition of stress really is very much different from within the age group as well. Now, as Hafsa, you asked what is the real and what is real. Real is a metaphor always, because what is on the surface. For example, if I can say you that what is going on in my life, like what I can see in social media. For example, you are in a restaurant now with your partner or with your parent and you are enjoying a good meal. So that is basically the real life that you are showing to the audiences.
Yes.
But what is the real thing? The real thing is probably you have one assignment tomorrow and you can understand that there is a consistent, persistent stress that is sort of hurting yourself and consistently making you feel irritable, because you know that no, I need to finish so many tasks but I really don't have any time left. So that is known as my real life stress factors.
Very true.
So here we need to understand that as I spoke about, not only for the cancer patients, because as a psycho-oncologist, most of the patients that I counsel on a day-to-day basis, those are either cancer patients or the caregivers. There also we find, for example, if we talk about any patients, whenever I am calling them and I am asking that, how are you feeling today? The first answer that they are going to give you that, everything is fine ma'am, everything is fine. I am able to eat properly, I am able to sleep properly, I don't have any pain, I have strength enough, and also I am able to do my daily chores by myself without anyone's help. But when I start digging into their stress, then I get to know that no, that is really not the real issue. You have sleep disturbance or probably onset of dreams, you are not able to sleep properly. Mild pain factors are there, either in your shoulder or probably psychologically also you are experiencing brain fog because of the treatment side effects, or probably you are not at all interested to eat food because of multiple stress factors. It can be either from your psychological domain or probably the social domain, or because of the treatment side effects as well, which can also come from your relationship issues, either kind of sibling rivalry, or probably you are not able to go to your job because of the treatment. There is some gap in your academic career as well. So the conclusion here, if you ask me, it's not about the real, like what I am able to see on the surface level. Rather than it's always the real version of yourself, which is unspoken, which is hidden, or probably which you are not able to express properly. For that here, the psycho-oncologists, they really play a very crucial role, because here we do not try to focus on the real, like what you are showing it to us, rather than what you are really feeling, like your unspoken emotions, your unspoken words. So that is, in a nutshell, the difference between, as you said, that what is real and the real stress.
I could, to be very honest, Jayatri, I could definitely relate to most of the things that you said, whether it's career gap, whether it's a relationship between families, work-life balance that we sometimes find it difficult to manage. It's just unspoken. When we come to work, we're always like, haha, hee hee. But deep inside we know the workload that we have on our shoulders, and the responsibility to take care of so many people, whether it's home, whether it's patient, whether it's career. I think what you said is really true about the difference between real and real life. What do you have to say about couples, media, or the stress that the media and the couples portray, especially social media, to be very honest?
Excellent question, Hafsa. So if you see, most of the reels that is trending nowadays. For example, a few checklists that you need to follow to maintain a good relationship with your spouse, right? And the points that probably most of the social medias they are showing that you should have a few checklists, 5 you should follow, and like probably these 5 are red flags and the green flags. These 2 concepts are very common, what I can found nowadays. But now at the end of the day, you need to understand that you should not be influenced by the social media, because whatever the social media they are showing, that is a very generic concept. It's not designed depending upon the personality. You are a different person, your spouse or probably your partner or probably your brother is a completely different personality altogether. So how can you judge someone just depending upon a small reel when the reality is completely different? The reality should be based on how you are observing that man on a day-to-day basis. So the distress or probably the stress comes from when I start sort of comparing. So all these green factors I am able to see in the social media in the reel, but in the real life when I am meeting to that person, probably those characteristics are not present, right? So probably we start assuming that no, probably so this person is a completely red flag for me, and the stress exactly starts from here. So as you said, Hafsa, the first the recommendation should be, I should not compare my relationship or probably my stress with the reel that is being portrayed by XYZ other persons. Rather than I should have my own judgment, and number 2, acceptance. I need to accept that person. If you feel that, fine, these are the characteristics and the qualities that is present, and yes, I will be able to accept the same person with the same characteristics, so fine. So there should not be any discussion about the reels that is being portrayed in other social media or the XYZ platforms. The same thing, Hafsa, if I talk about the cancer patients. Couple relationships can get affected badly during the cancer treatment, and which is true, and it's kind of, I must say, researched by many psychologists. So here let me add you a few points that either it can be a husband or a wife, and because of the cancer treatment, if you are undergoing very rigorous treatment, obviously you will be having multiple side effects. There can be hospitalization, probably you will not be able to do your gender roles or probably your family responsibilities, the role as a spouse. As a result, what will happen? The real responsibilities or the real the relationship that you have promised to your partner to fulfill at home or probably outside, including the financial support, you will not be able to provide, obviously, for a very certain reasons, and as a result, there can be conflict between the husband and wife as well. So, it's very important that as a psycho-oncologist, I would like to convey, it's very important to understand even that time as well. If I know the strength in my relationships, who am I, what are my expectations, who is my partner, and why should I stick to this man or probably this female, this woman, the rapport can get, or the open communication pattern during this difficult times also can get improved to the greatest extent. So as you asked that, yes, first, and in a nutshell, if I kind of give you the points one by one, number 1 should be that my real life is completely different in comparison to my real life. So I should not compare my life with someone else's, because the material condition is completely different from my life. And in social media, sometimes everything is a little fabricated what I felt from my personal experience.
Yes.
Because they are showing their life, but you are a completely different person. You are from a different, you have a different socio-economic background. Your belief systems are different. Your person is also different. So we should not compare my personal life, my professional life, depending upon someone else's, some 1 minute or 2 minutes reel in social media. That always we need to understand. Number 2 is my acceptance. If I know that I like this person, or probably I like my job, I like my house, I like myself, I like my own personality, then your strategy or your technique, the way you are dealing with your partner, that is also going to be changed completely, right? So, and the most important thing that always we need to believe that is that if you are a spouse, either husband or wife, that is called unconditional support to a certain extent if we start providing without comparing my relationship not only in comparison to any social media reels but also with my friends or their suggestions, their recommendations. So all these things I think we need to follow. So it's all about the comparison. We need to stop comparing our life with someone else.
Actually, this is also relatable for someone as Gen Z as me.
Okay.
Because when we look into social media, all we get to see is beautiful faces, beautiful figures, expensive outfits, and the perfect lifestyle that the couples live. Happy couples that they go on the trips. And as cancer patients, most of the people might be watching these, and definitely they will have a lot to think about and compare their lifestyle against them others. But you're right about the positive affirmations that we have to adapt on how I look and how I accept my family is, and how I love my husband or my friend, to whoever they are, and not compare them to the real life that is shown. I think that's very powerful message that everyone should adapt to. So I also have a question about the serious illness that the patient faces in the context of the cancer. So what do you have to say about more about it?
A very important question, Hafsa. Because this is not only about the mutual conflict or the very shallow level stresses. Rather than, as you asked about, if someone has very chronic diseases, like it can be, for example, cardiovascular diseases, or probably your husband needs to undergo dialysis, or it's a cancer. So it's not a very 1 week disease that you need to be hospitalized. Sometimes even the treatment protocol can go beyond 6 months or 1 year. So here we need to follow a few important guidelines. First of all, we need to understand that, as we spoke earlier, that is acceptance. Acceptance is the most important thing, that we need to understand that even if I am trying to improve or to maintain a good relationship with my spouse with unconditional support, I can be irritated as well. Because yes, as a caregiver, I am not only fulfilling all the responsibilities as a daughter, as a mother, or probably as a father and as a husband as well. Yes, even after that, even if I am taking care of someone for 24/7, I can be a little irritated and anxious as well, and that's absolutely fine. Number 2 is the open communication. Most of the time during the session, what I find that there can be a mild, I don't want to say it as a blame, but sometimes we do not know how to express ourselves. It's like, you did not finish your breakfast and I spent so much time for you, and that was the reason now I am late for my work. But here we need to understand, probably the patient is experiencing CINV, which is chemo-induced nausea and vomiting. That's the reason. You can just simply change your tone, like the way you are reframing your sentence, by saying that, I'm really sorry to say, but I felt really bad when I was trying my level best. But I can also understand that you have certain difficulties, that's the reason you could not solve. It's like, rather than starting the sentence like, you did not eat, that's the reason I am late. You can just switch it, you can tweak it like this, that I tried my level best and so I will request you to finish your food. So what happens, if you start in a sentence like by telling directly you have done it, the samne wala person can feel that, oh my god, so you are blaming me, you are pushing me so hard. So that's the time when our relationship starts breaking down slowly, one by one. Number 3, which is very important thing, but we often sort of deny, that is the physical intimacy and the emotional intimacy during the cancer treatment. So many people, they have that misconception even during the counseling session, Hafsa. Many female particularly, even the male also I have seen that, they have the direct question that, can I involve in physical intimacy with my partner now? Even they are so hesitant to discuss this question with their doctors as well. Because they feel that, no, I am going to the chemotherapy or surgery or radiation, then why should I even talk about all these things? Those are completely not needed or not necessary. So here, we need to understand that this physical intimacy, it's not at all addressed properly because we feel that, no, it's not needed. So here always I would like to give one example. If you are hungry, you eat food, right? So if you need love, then why do you want to not talk about this point? This is a very important factor. So here the advice should be, physical intimacy doesn't always means that it's a sex. So we need to understand what is the sex, and if you want to know more about it, probably we can talk about it. So if you want to be involved with anyone in a very emotional way, there are multiple processes are there, and we can always have a very good session, or probably in the next episode we can always talk about it, right? So as you asked, Hafsa, if I if I want to summarize all the points one by one, number 1 is, I must say, the open communication. Open communication in the sense, the caregiver is also busy 24/7. They have multiple responsibilities also. The patient is not feeling well. So it's about how I am communicating my pain to someone else. It's not that I am blaming them, I am pushing them, rather than that how I am communicating my concern for that person. So this is a very crucial point. So always replace this you with I. Like, I felt bad, I am trying my level best. Okay, number 1. And what is number 2? That is acceptance. If we feel that, no, because of the mastectomy, one breast has been removed, or probably my husband has a stoma bag, or probably he has a rice tube, or probably there is a port placed because of the chemotherapy. I need to accept, and yes, I need to take care of that person the way he is. Number 3 is the physical intimacy. Physical intimacy should never be ignored. By chance, if your doctors, your oncologists suggest that, and if they feel that it's important, they are going to convey this to you. But if your oncologist, or if you feel that, no, this point is very kind of not at all important, that's not right. So kindly I'll request all the patients, if possible, have a direct communication with your oncologist, and the psychologists are always there. We can also tell you that, emotionally, if you are continuously available with that person, then certainly during the cancer treatment or any chronic disorders or disease, your prognosis will be better, your well-being and your quality of life will be improved as well. So this is always a thumbs up.
Okay. That was actually very well explained. I don't have anything to repeat. It was very deep and very well explained, to be very honest. Now, what will you advise for patients, like the quick tools that you could use on a daily basis that will be helpful for the cancer patients to go on, whether it's all social media, whether it's the relationship, just like a summary of the everything that we spoke about, just few points, so it'll be like, okay, yeah, this is what we spoke, and like quick tools for our viewers.
Wonderful. So here, Hafsa, before answering your question, let me give you a very good example.
Okay.
So last week, it was weekend, and I was watching one movie. I guess many of us, we have watched this movie, that is Rocky and Rani Ki Prem Kahani.
Yes.
If I'm not too wrong about the movie name. So what shows there that two people, they came from completely different background.
Yes.
Either in terms of educational background, to the cultural background, their family's thought process, or probably from their language as well, their and other aspects as well. Because what I understood that not only two persons came from the different background, also their families, their thought process are completely different. So the point what I really loved, that even after all these obstacles, when they started fighting with each other, but they started finding as we spoke about, the green flags. And they did not decide it, depending upon their family's opinion, depending upon any extra, kind of like drama and others. They started exploring each other's certain qualities that can soothe them, that can enhance them as a person.
Yes.
We are not complete, we are always incomplete to a certain extent. So within a couple also, we need to find certain qualities that can make each other fulfill, make each other complete. So now, if I would like to summarize everything, so I would like to start with number one, that is, you are a completely different person, and your husband is, or probably your partner, your wife is also a completely different person. So please do not compare yourself with any other reels, because that is not your real life, number one. And number two, if you are seeing your friends, they have some colorful life, they are going for dinner, they are doing that, XYZ, please do not compare your life with your family members and with your friends as well. Because the material condition and the personality factors, everything is completely different, number one. And number two is open communication. To a certain extent, Hafsa, we expect a lot.
Yes.
Our expectations, like we feel that whatever I am feeling, as my mother, as my brother, or as my spouse, you are going to understand that.
Yes.
No, but that is not going to happen anytime. So we need to convey it. And that is the definition of open communication.
Yes.
I need to talk to you, otherwise how will you understand? So probably you are out for a dinner, you guys are laughing, you guys are smiling to each other, but probably you do not know, you need to submit one assignment tomorrow in the office, but you want to make your father happy, that's the reason you are smiling. Probably you do not know that probably your father needs to, have a big EMI tomorrow. And even after that, just because he wants to make you feel happy, and that's the reason he is smiling and you guys are enjoying a good dinner. So here, we need to understand we should not assess anyone depending upon their surface level. Rather than we need to go deeper. So, this is the thing, as a psychologist, or probably if you want to improve your quality of relationship, either as a spouse or probably as a brother, as a student, or whatever it is. So first I need to focus upon the acceptance of that person. If you are a cancer patient, if you are my mother, if you are my father, if you are my partner. And number two is that I must stay here. That is, I need to understand the person the way he is, and then open communication is mostly important. Don't expect that that person is going to understand, because even if you are putting a lot of effort, the person has also so many physical issues going on. So how is it possible that the person is even after all this, the person will be in a mental condition to understand? So you need to communicate in a very clear and very direct way. And number three, that do not feel that you could not do it, rather than I tried my level best, but I felt bad when it was not possible for you to do it. So things are very different, right? So I think, Hafsa, these are the small points that I can sort of add.
Small yet important and very powerful points for all the viewers watching. It was very interesting to talk with you. I got to know a lot of things, and there were so many things that I think the viewers could relate to. And thank you for helping out in this situation. I just received a lot of questions in the live, so I want to ask you more on this.
Sure, certainly.
We'd like to take more in the questions, so you guys can keep texting. There's one question that with the recent news on mental health, can you throw some light on how the cosmopolitan life causes stress and frustration, and how to cope up with them?
Oh, amazing. So, here we need to understand a few things, that the cosmopolitan life. So, what is the definition of cosmopolitan life? First, you should be clear about that, right? And stress, it's always about that, again, if we talk about the real and the real, the cosmopolitan life, whatever they are showing, that's in the real. That is not the real. So we should have a very clear, clarity in my mind that whatever they are showing, am I the same person? Probably X person is wearing, something expensive outfit, or probably they are dancing in one expensive place and they are making a reel and they are showing it to us. So first I need to compare whatever the person is showing. Is it like he has purchased that outfit, or probably this is just a brand collaboration? You never know, right? So whenever you are finding any videos or probably some audios, first we need to understand that, am I that same person? Can I identify myself with that same person? Or probably whatever they are showing, is it really the reality of that particular person, or just to gain some views, or probably this is just a business account? So it's all about the comparison. The first thing that we are talking about,
Yes.
I need to stop comparing myself with someone else. Everyone has their strengths. For example, I'm a psychologist, right? So my strength can be my counseling sessions, but if someone is a doctor, surgeon, their skill set will be, they are a very good surgeon. So now I cannot compare myself with a surgeon as well altogether. So I'm kind of like giving you a very small example. So coming to the cosmopolitan stress, as the person has asked, I must say that first of all you need to stop comparing, and number two, it's very important to understand the purpose. Why do you want to follow that particular person? That person has certain mindset, certain target, or certain purpose. That's the reason probably they are showing that kind of lifestyle in a reel. But what is your purpose? What is your target? What benefit you will be getting? So this is, we need to analyze ourselves, and in psychology that is called introspection. When I am trying to understand my own need, my own desire, my own target, and my own purpose. So if you are very clear on these parameters, I guess you will be able to control your,
To
stress.
cope with the session.
Yes.
There's another question that says, how to identify the signs of emotional burnout from cancer patients? How can a partner find it and support her or him?
Wonderful. So, very recently, I guess last Saturday, if I'm not wrong, surely I will not reveal the name as per the protocol. Everything starts from, if I talk about partner, to be very honest, as per my clinical practice, let me give you the example. It starts from, if my partner doesn't want to be close with me physically. That is our first point. To be very honest, most of the patients, as per my clinical practice, they have reported this to me. Whenever they are trying to come close to the partner, certain push. Please don't touch me, or probably I will not participate. You can do whatever you want to do. These are the narratives. So, and number two is the irritability. What is irritability? Like, you are nagging continuously. I will request you to eat, I'll request to eat. Why you are not eating? Your dietitian, they have asked you to follow this diet pattern. Otherwise, your weight will lose. And the person will be more stubborn, more irritated. And you will start understanding, no, probably, there is some, the patient is not feeling well. Number three, if I tell you, that is, if, for example, you are trying to be very overprotective. For example, my patient is around 60 years old, and as a spouse, I am very protective for my wife. I don't want to do her any household chores. I want her only to lie down, only to take rest. What will happen after that? I know that my doctor has suggested that my wife can do all the household chores, but even after that, just because I am very overprotective, I love my wife a lot, I am asking her to take rest. And again, my wife is gonna feel irritated. So if I, kind of jot down 1, 2, 3, 4 points, like how you will be, like how we will start noticing. The first important point, that if my spouse is not at all interested in terms of physical intimacy, two common statements that come from here: I will not participate, you do whatever you want to do. I don't want your touch. Because but I don't want to dissatisfy you as well. So I'm sort of negotiating. If you ever find this trait, this is a very common trait and very important trait as well. Number two is that if if they are very disappointed, like you are nagging for eating, particularly during the daytime, and they are pushing, no, I don't want to eat. Number three is that I must say, if they start losing their own confidence, and if they want to be dependent upon you, even if they have enough physical strength and motivation and psychological morale, because you are very much overprotective, because you love your partner a lot. So these are the small things I guess we need to focus on.
That's a very good thing that many people should notice. I guess that answered the question. The first question had this one more comment that said that by cosmopolitan, I meant the 10 to 12 hour shift, the 2 to 4 hours of travel, the traffic, the honking, the frustration of the job on road, and then feeling low at home and with family. How to deal with such a routine? Even I have that question.
Okay, so I'd like to ask you that, are you following the schedule on a daily basis or probably once in a while?
Yeah, once in a while, or maybe some people there are who go on a daily basis. So why don't you answer both things?
Okay, so here it's called the time management. Always, we have a protocol that if I know that I need to reach office by 10 a.m. and I'm in Bangalore, so I know that I cannot start by 9 a.m. I need to start by 8 a.m. And this is the time management, let's accept it. Okay? As we spoke about the acceptance, I need to accept. So I heard, one beautiful quote by someone, one very famous poet, I really can't remember the name. He said that no one likes to go to job, but we need to do that. No one likes to go to office on time, but I need to do that. No one likes to have a healthy diet, but I need to follow that. And we need to do that. Even if I'm not trying to do, I'm not liking to do, I need to do that. And that is the essence of my life. And as we spoke about the purpose, and that is the purpose of my life. So if I want to gain something, yes, I need to do something. And so this is also all about the acceptance here that we are talking about
Yes.
so long. That I know that because of all these parameters, if I suffer, if I compromise, at the end of my month, I'm going to get something out of that. And yes, that's like a drug, right? So if I get that adrenaline push for that, I need to do all these 1, 2, 3, 4, 5 things. And for that, the only thing is that time management, because yes, I'm one of the victims for that as well, because I really travel 1.5 hours only for 1 week because of the heavy traffic. So I do understand your concern.
That was a good one. And a lesson to learn for me and for the viewers watching. Time management. Okay, there is one more question. Patients tell I am mentally strong but still feel anxious. How to identify the hidden stress? I think it answers the first question that you answered, the second one. How do you, can you go again? Patients tell I am mentally strong but still I feel anxious. How to identify hidden stress?
Hafsa, it's a very important thing that we need to understand. As I talk about what is the main definition of real and real. What is real? Which is in surface. What is in surface? I'm fine.
Yes.
What is in depth and what is unspoken, that is real feelings. And if I want to dig into real feelings, I need to ask them questions. We call them the Socratic questioning. What are those? Simply WH questions. Why, how, what, how come, when, is it really? Number 2 is that empathy. It's not sympathy. Oh my God, you are feeling pain. I feel so bad for you. I am crying. So that is called sympathy. What is empathy? When I am understanding your pain, I am not showing any, oh my God, I feel so bad. Rather than I am trying to understand, also I am conveying this pain in a very positive way, I must say, so that you can also understand, chalo, this man is not doing any kind of pity for me. Rather than he is trying to understand my pain, my emotions. So we are on the same boat here, even if you are not a patient here, right? So coming directly to your question that How is it possible to understand
How to identify the hidden
how to
stress?
identify the hidden stress? First of all, you need to ask questions.
Hmm.
Asking questions. Number two is, and that's possible if you know how to ask questions using no sympathy but empathy, using the WH questions. Number two, observing the behavior. Don't assume that just because you know they are fine. So here, give me one example, Hafsa. Most of the patients, particularly if they're old patients, whenever I speak to their son and if I ask them, how is the sleep pattern of your father who is probably 65 years old? The first thing they will say that, my father is able to sleep at night very nicely. Then my suggestion or my recommendation should be, just observe your papa at night 2:30 am, touch their toes slightly and try to observe if there is a slight movement. If there is a slight movement, it means he is not sleeping or probably he is oscillating between deep sleep and shallow sleep in a very simpler term. So, in psychological counseling session, we try to make you understand that the small parameters so that you can understand the hidden stress factors. And if someone is not able to sleep, it's not like that they are not able to sleep because of no reason. There can be multiple behavioral patterns, multiple psychological patterns as well, right? So you need to observe and so you need to kind of follow a few behavioral checks for the patients as well. Number three is the communication pattern. Are you able to express everything, yes or no? Which is called the open communication pattern. Some people, are you confident enough that you can ask this question to your patient? Sometimes what we have noticed that the patients are also, the caregivers, they are very emotional and they don't feel that they have right information or right strategy to ask questions. For example, breaking the diagnosis. Most of the caregivers, they do not want to break the diagnosis to the patients and they say that we do not know how should I convey. If my father asks me that XYZ questions, then probably I will not be able to answer. Then I don't have the guts to ask the question. So all this about, are you confident enough? Do you know how to break the diagnosis? Do you know how to handle his emotions? So these are the things that I think, all the caregivers should be very much aware about. And yes, if you want any help, consult with the psycho-oncologist or probably your psychologist or you're comfortable with. So I guess like this, you will be able to identify and handle the stress for your patients.
Thank you, Jyoti. I guess it answered your question. There's one more question. What techniques can help me manage my stress on a daily basis? Like you can mention 5 techniques or just 4 techniques which a patient can use or generally a person can use.
Okay. So, managing the stress, if you're a patient and if you're a caregiver, this is going to be completely different. So I'm assuming that you are a patient but not a caregiver. So if you're a patient, the first thing is that if I want to manage my stress, I need to calm me down at any point of time. If my emotions are already heightened, then even if the decision I am taking, probably that is not going to be better. That will be disturbed and distorted, right? So, so then my actions will not also be proper as well. So first is the stress management techniques. And the most important stress management technique is mindfulness meditation. Mindfulness meditation, we all are aware about it. It's like simple deep breathing technique so that my parasympathetic nervous system can be calmed down at any point of time. Number 2 is that I must say positive affirmation. Positive affirmation, it means that I am confident enough that I will be able to do that. That sometimes we use in terms of cognitive behavioral therapy as well. It's like, I will not be able to do it. I can simply change it to, let me give a chance. I will try one day at a time. So it's all about, I will try one day at a time. This is always about, let me give a chance. Let me try. I will give one day at a time. Right? So this really helps a person to boost their confidence. Number 3, that is the here and now approach. So what is here and now approach? When most of the patients, we always anticipate about future. For example, how many months my treatment will go on, if there is a cancer recurrence, or probably, if my condition deteriorate, what my doctor will prescribe and, and other questions as well. But here, you need to understand, I need to follow not about the past, not about the future, rather than I should be focused upon my present. It's like what I'm doing today, what I'm feeling today. Probably, how I can take care of myself today, how I can make me feel happy today. So these are the questions, and we call it the here and now approach. I strongly feel, if we can follow these three important domains, number one is mindfulness meditation,
Yes.
number two is positive affirmations, and number three, at the end of the day, as we spoke, that is the here and now approach. Focusing myself on the present, and number four is the acceptance. I need to accept that if I am not feeling good today, that doesn't mean that I will feel bad tomorrow as well. So I am a human being, and because I have cancer, because I have treatment side effects, I can feel sad today and even tomorrow as well, but that's normal. But what is very much important here, that even if I am not happy today, that intensity should not cross certain limit, and I should be aware about that as well.
Yes.
So that is called my mindfulness. So I guess self-awareness and self-acceptance, then accepting the present, and certain positive affirmations and mindfulness breathing. If anyone can follow these small techniques, and also, you are a dietitian, Hafsan, you know that apart, the diet also plays a very important role,
Yes.
not only that being physically active.
Yes.
So I guess these are the a few things that I would like to convey to everyone.
That's very good. I hope everyone just noted it down, because these are the tricks that if we just add on step by step, one by one into our daily routine, it will help everyone a lot to manage their stress. Like you said about being sad is okay. So there's a similar question that says that how do I help my family understand that I cannot be smiling each day? I cannot hold the tears and the pain in anymore. How do I express myself? I feel like I'm locked in a dark room.
Okay, that's the reason from Forbes Care we provide not only the session for the patients but also the family sessions as well. The sessions for the caregivers. If I directly come to your question, that the family also needs equal support, because we are in India, and even let me tell you, the few countries we have that strong mindset that if you are crying, then probably you are a very weak person. And particularly if you are a male, or the male, I must say, that people, they are going to laugh at you, oh my god, why you are crying like a girl, right? So since the beginning, this is not sort of enforced or probably encouraged by your family members, that if you are feeling bad, you can cry as well. That's the reason I will tell you, if you feel that no, you are not able to openly convey that, crying is a very normal. This is one of the most important part of your emotional catharsis. Kindly, I will request you, please connect with the psychologist if they can have a word with your family members. Because certain stigmas are still there in India and other probably the South Asian countries, and we are not against of that, I must have that mindset, but yes, I strongly feel that certain modifications can be needed. So I will request you, sir, or probably ma'am, if you feel that no, you are not able to convey your emotions to the family members, let's give us a chance so that we can have a word with your family.
Okay. I'm not going to burden you a lot with a lot of questions. Because patients are just so curious to know more. Because finally there's a live session with you. And so there's this question that says, what are the interventions if a patient who is at an advanced stage of cancer is suicidal?
Alright. So, yes, there are multiple researchers. I don't want to quote the exact percentage, but yes, if someone is in end of life or probably the very end stage, we have seen multiple researchers where there are history of suicides. But we need to understand, suicide is just a term. There can be suicidal ideation as well. So here, if I directly come into your question, that a few things are out of psychologists' area of expertise. If you find that, because we always use one parameter that is called distress thermometer by NCCN guideline. If you feel that, depending upon those parameters and your basic screening questions, if you ever find that there is a suicidal ideation, but probably if your patient, kind of says that, I am planning to, or probably I don't like my life, I just want to end my life, I have nothing left. Try to probe more. Exactly, is it only because of they have pain, or probably they are seriously thinking about it, right? If you feel that no, this cannot be managed using normal psychological counseling or therapy, as a psycho-oncologist, I will sincerely advise to consult with a psychiatrist. And it's as per the international guideline I am telling you. So we need to understand not everything is in our hand. As a psycho-oncologist or probably as a psychologist, our job is to identify what is the level of distress, whether that person really has suicidal symptoms or probably ideation or probably suicidal attempt as well. How will you understand? Like if there is some cuts, or probably I know that how I am going to commit suicide, with a rope or probably with some phenyl, kerosene or XYZ. So there are multiple segregation, in the suicidal term. I guess you are completely aware about it. So if you feel that no, my patient has already decided that pakka they are going to commit suicide, they have a plan ready, they have multiple attempts as well, without any hesitation, I will request you, do not keep that case in your hand. Directly inform this with the oncologist, the consultant oncologist who is taking care of the patient. Number 2, inform the family members immediately. Remember, here you are not breaking any confidentiality. Number 3, please suggest any psychiatrist if you are aware of. So your job will be referring that case to someone else. So this is all about it.
That's a very good point. So if you find such symptoms from your patients, your family members who are undergoing cancer treatment, who are like, I'm into a lot of treatment, that I'm not able to handle the treatment anymore, the medications are a lot, it's troubling me mentally, watching my family do so much for me, you do have this tendency to think that okay, if I end my life, maybe I might be able to, ease others' life. So that is a very wrong thought, and the caregivers, if they notice such tendencies or symptoms from the patients, I do request to follow what the psycho-oncologist told, Ms. Jayatri ma'am. That is a very strong suggestion to directly consult with the psycho-oncologist present near you, so you can handle the situation better. And I really thank you guys for staying with us, watching the live, and thank you Jayatri ma'am. This was really a very interesting and helpful session. With what you let us see you guys again in the next episodes, upcoming episodes. Thank you.
Thanks to everyone.
And also you can download the OncoBuddy app in your phone, where the dietitians, the doctors, the psycho-oncologists are present, where we will be available to get in touch with you, clear your queries, or meet you or see you online, and you can also post your queries and we can answer your queries there. So download the app, follow us on, we're also available on YouTube, even follow us on Instagram, so you will be aware of each and everything that is required on time. Bye bye.